Breakfast with Spaniels with Dr. Judy Morgan.
Jerry Bidgood was first this morning. Joyce, you're right behind. Good morning, everyone. Hi, Teresa. Hi, Marilyn. Good morning, Joey.
Remember,
Dennis.
You can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
Oh man, our dogs are being bad already this morning. They're just so bad. They're so bad. A little bit wet outside. Ew, can't get my feet wet. For God's sake. Going out to see your integrative vet, that's good. Okay, so yesterday, late yesterday, Gwen sent me a text message because she is, as many of you are aware, she is babysitting her dad's bird, Marvin, and his cat. The cat actually started out as Gwen's cat, and when she went off to college, the cat stayed with Dad. And anyway, it's evening in Australia. So she's got them for a couple of months, probably while they're looking for a house. When is the cat health convention? Next month. Baby Kitty is pretty stressed living at Gwen's house with dogs. She doesn't normally live with dogs and other cats. And Edward just likes to pester everybody because he's a kitteny sort. He's only a couple years old. And he just thinks it's fun to make everybody play, even if they don't want to. So poor baby Kitty has basically been hiding out in Gwen and Brandon's room that they use for an office and guest room, and their guest bathroom. And baby Kitty does not like to use the litter box that everybody else is using. And so Gwen tried to make her own area in the guest bathroom, and baby Kitty decided that the carpet, the bathroom rug, was a much better thing to use. And baby Kitty is so stressed she only pees once a day. And so Gwen's concerned about her holding her urine that long. And she said, wow, this urine really smells bad. So Gwen's concerned that she might have a urinary tract infection. And baby Kitty hasn't had a big workup in a few years. So Gwen said, okay, well, I'm going to call Dad and see if he'll let me take baby Kitty in and get some blood work and a urinalysis and a urine culture. So, she said, what should I ask for? So I gave her the list of what to ask for. And she made an appointment and took baby Kitty in yesterday and told them what was going on. And so they did a bladder ultrasound to make sure there were no stones, which was good. But of course, Gwen had to ask for that. And Gwen asked for a urine culture because when she went in and described the situation, the veterinarian said, oh, well, let's just assume it's a UTI and start her on antibiotics. Gwen, being well informed and also a guardian of our world, said, antibiotics with no idea if we even have a UTI, antibiotics without a culture, so we don't even know which antibiotic we would choose if we had a problem, said, no, I'm not going to contribute to the antibiotic resistance in the world. I want a culture. And so the veterinarian was kind of taken aback. And what's really weird is here's Gwen standing there saying, I got a credit card and I want full lab work. And the kitty is a teenager. I said, I want full lab work. I want to pay for a culture. I want to pay for an ultrasound. and she's getting pushback from the veterinarian. It's like, wow, I'm offering to spend like hundreds of dollars here, and you're kind of going, well, here, I'll just give you antibiotics. Is this because we're too lazy? Or is it just because that's how we have done things wrongly for so long? So Gwen got them to do the ultrasound, got them to get the urine for the culture. Culture takes 3 to 5 days to get back. And so, when they were all done with everything, the veterinarian said, well, I'm going to go ahead and send you home with the antibiotics. I want you to get her started because it sounds like she probably has a UTI. And Gwen looked at her again and said, what part of I'm waiting for the culture do you not get? So, of course, Gwen's texting me about this, and she's like, I can't believe this. And, the problem is that's pretty much the way it's done probably 90 to 95% of the time. Well, yeah, we need more Gwens in the world. I'm trying to make all of you into that as well. Yeah, it's more expensive to do it this way, but you're going to get a real answer. And you're only going to need to give antibiotics if they're actually needed. And you're going to give an appropriate antibiotic, so you only have to go through one round and you don't have to keep repeating this and, blah, blah. So Gwen was very good, stood up for what she believed in, what she knew was right, and said, yeah, I'll come back for the antibiotics, not a problem. You call me when you got culture results and lab results. So that sort of set me, we basically, when we were texting yesterday, I said, which one of us is doing Facebook Live tomorrow? Because this sounds like a good rant. And she said, oh, well, I'm preparing something. I'm sort of ready, but sort of not. And I said, well, okay, I'll do a rant tomorrow. And you can have Thursday. So I think you get Gwen tomorrow. Had to insist on blood work yesterday for your dog with GI issues. They wanted to just give her antibiotics, not knowing what's wrong with her. Yeah, and they probably wanted to give metronidazole, which has, neurotoxic effects and a lot of other effects. So, yeah. Yeah, your vet always wants to start antibiotics while waiting for the culture. Why bother doing the culture? Jeez. Anyway, so while I was scrolling through posts this morning, I came up with a whole bunch of other wrongisms that make me want to have my eyeballs bulge out of my head. So one person posted in a very holistic site where no kibble is recommended. She said, oh, best thing to do for your dog with diarrhea is to add kibble. That always firms up the stool. Okay, totally the opposite of what we need to be doing. So that was just an owner with a bad idea, but I'm sure she was given that idea by her veterinarian. So another one where they go to a holistic veterinarian and they had been using Frontline, and for some reason they didn't use the Frontline and they wanted to go to something natural. And the veterinarian went a little ballistic, and this is a city dweller dog that lives in an apartment. And the holistic veterinarian said, oh no, you have to apply Frontline every month. Otherwise, your dog is going to get ticks and fleas. It's an apartment dwelling dog in a city. Holistic vet. I'd run. So then I saw another one that posted, I asked my veterinarian if I could get a titer for the rabies vaccine. And my veterinarian said, I don't think there is such a thing. I've never heard of a rabies vaccine titer. Okay, obviously they don't do any work with import-export of animals in and out of the country because they would know that you have to have rabies vaccines and then positive titers to get these animals across borders. So what are they teaching in vet school that veterinarians are not aware that there is a titer available for rabies vaccine? And one more. Somebody posted, again, in one of these holistic sites, that somebody said they wanted to give their dog coconut oil and wanted to know how much and how often they could give it. And somebody replied and said, oh, you can't give your dog coconut oil. It causes atherosclerosis. It'll cause your dog to have heart failure or whatever and cause obesity. And I was like, that is absolutely false. Dogs do not get atherosclerosis like people do. They don't get heart failure from atherosclerosis. And I eat a ton of coconut oil every day. I'm not obese last time I looked. And it doesn't make our dogs obese, but you do have to account for the calories that you're adding. So I posted that it was, false and she was spreading bad information. And her response was, "Oh, that's what my veterinarian told me." Okay. Okay. So, yeah. I don't know what they're teaching in veterinary school, and I don't know what articles they're reading. So there was an article, I think it was in the New York Times, and of course it got lots of play, maybe a year ago, where some doctor somewhere said that people shouldn't eat coconut oil because it causes atherosclerosis and obesity. Wrong. And of course, everybody jumped all over that and translated that into animals as well. And by the way, somebody out there is going to say, "You're wrong, Dr. Morgan." We do see a little bit of atherosclerosis in older dogs that have hypothyroidism that was never treated. So they're usually older obese dogs that have never had their disease taken care of. That's the only time, and it's really rare. So, picked up a dog with disc issue. Breed rescue would take her, but they wanted to do rabies, DHLPP, Bordetella, Lyme, and Lepto. Find a different rescue, because there are rescues out there that won't do all that stuff. So, yeah. Thank you for the holistic vet finder. But, even when you walk in that door, you got to figure out if they're really holistic or not. If you walk into a big bank of prescription diets, and, there was a holistic vet near my practices. He was probably the closest holistic vet to us, and he sold a ton of prescription diets. He strongly recommended Lyme vaccines for every dog that walked in the practice. He had a lot of beliefs that I found to be inconsistent with being more on the holistic side. So, love these wrongisms. Yeah, I'll see how many more I can find. I mean, that was just in like 5 minutes this morning. I was just like, yeah. It's fun and games, guys. So, all I can say is same thing I said in supporters on Monday night is educate yourselves. Be armed with your education. Don't be backed into a corner. And when they want to give medications inappropriately, just say no. And if you do accept medications, ask what are the potential side effects so that you know what to look for. Just like when you go to the pharmacy and you get that little sheet with your medications that says, these are all the side effects, contraindications, cross reacts with this, that, and the other drug. You guys need to know that. Do my books cover using essential oils for flea control and preventatives for heartworm? Yes. Well, the from needles to natural, that one. That's it. Anyway, okay. You saw a holistic vet who had Brevecto on the shelves. Yeah, run. Yeah, Jean Dodds for thyroid workup, hemopet.org. She's the leading expert, veterinary expert. Hemopet.org. Let me see if I can get that in here. Your vet can send the blood work there. They won't want to, but they can. Again, stand your ground. Get the blood sent where you want it to. Second favorite lab for thyroid is Michigan State University Veterinary. For Cushing's testing, got to go to University of Tennessee Veterinary Diagnostic Lab. For GI, it's got to go to Texas A&M Veterinary Diagnostic Lab. Each university kind of has their specialty. So enjoyed the lab supporters presentation. Yay, good. What do I recommend for nervous dogs? CBD is great. Sorry, typing. Can't talk at the same time or I'll type what I'm saying. All right. Okay, everybody have a wonderful day. We got to go take care of donkeys, hinnies, horses, cats.
Welcome.
All those barn critters. Hey, Michelle Allen, how are you? I still got to read the book, Michelle. I'll make time. Somebody who uses MSU for the hypothyroidism. Yeah, it's a great lab. So much better than just sending it to Antec or IDEX. And frankly, I think their expanded thyroid panels, they're probably sending off to a different lab. All right. Have a great day, everybody.